In this section, we're going to talk about the Jiao points and how they relate to the large intestine meridian, as well as this superficial back arm line. So one of the first things we need to bring attention to is the fact that many Jiao and large intestine points have a similar function, and we can see this even from the traditional uses of them as used in TCM. So what I mean by that is we'll use large intestine and Jiao points for external invasions like when cold invasions and when heat invasions. We tend to use the large intestine points for the when cold invasions, and then we'll use the Jiao points for the wind heat invasions. But there's some similarity there in that they're being used for external invasions, and especially if the trapezius is involved and we get those external invasions affecting the traps or the neck and the back, then we can use Jiao and large intestine points, both for those types of external conditions. The points are also used for internal conditions, such as affecting the gastrointestinal system. Jiao 6 is the empirical point for constipation. And then we may also use Jiao points to clear out heat and fire from the digestive system. And we use large intestine points in a similar way. So we do find some degree of overlap with these points in treating internal conditions, external invasions, as well as back and spinal and neck and cervical and shoulder conditions. So I'm going to keep our discussion mostly to the shoulder and the shoulder joint. And we've talked about in the large intestine section how the deltoid is a part of this superficial back arm line. And we've discussed some of the standard points and treatment protocols using large intestine points. Now I just want to draw some similarities and comparisons between the Jiao and large intestine points. So let's begin by talking about Jiao 3 and Jiao 5. This is a nice point combination that we can use for shoulder conditions. We can use Jiao 3 for neck pain, and Jiao 3 and Jiao 5 is a nice combination you can use for pain in the trapezius. And in the System 1 method of treatment, if a client has pain on the left side at GB21, then we would needle the right side, Jiao 3 and Jiao 5. And that's a pretty effective point combination. I do like that point combination. I'll often do it in the second part of the treatment because, again, I want people moving the affected area. I want them moving their arms when I'm treating them for shoulder conditions. Okay, so Jiao 3, Jiao 5, nice little combination for treating pain in GB21. And we can see how GB21 is technically located on this superficial back arm line because of the traps being part of this myofascial line.